Mucorales and Aspergillus are two distinct groups of fungi with unique hyphal structures, important for medical understanding. Mucorales hyphae are broad, ribbon-like, and non-septate, meaning they lack cross walls. This feature gives mucorales a characteristic appearance under the microscope: broad, irregular, and with right-angle branching. These fungi thrive in decaying organic material and can cause infections in immunocompromised patients, known as mucormycosis. Aspergillus, on the other hand, has narrow, septate hyphae. These hyphae have cross walls that divide them into distinct cells. Aspergillus hyphae tend to branch at acute angles, typically 45 degrees. Aspergillosis, caused by inhaling spores of this fungus, can lead to serious lung infections, especially in patients with weakened immune systems. Recognizing the anatomical differences between mucorales and Aspergillus hyphae under the microscope is crucial for accurate diagnosis and treatment of fungal infections.